Now in Glasgow Coma Scale, we have basically 3 responses that we test for, and it is the eye response, the verbal response and the motor response. Now if you see here, the minimum is no eye opening is 1, no verbal response is 1 and no motor response is 1. So basically none response is given a score of 1 and not a score of 0. So the first mnemonic to be remembered is, remember, none response is a score of 1. None is rhyming with 1. So none is 1. So the minimum GCS score that we get is 1 plus 1 plus 1, that's equal to 3, and it's not 0. Okay, and it's not 0. Now second point, what is the maximum score that is possible? The maximum, we have the 3 components here: eye opening, verbal response and the motor response. So remember it in the sequence EVM, that's like the electronic vending machine. Okay, so remember it's the electronic vending machine and it is 4, 5, 6. Maximum E score is 4, maximum V score is 5, maximum M score is 6. So it is 4, 5, 6. That means the maximum score is 15. 4 plus 5 plus 6, that is 15. Right. And then you have the GCS-P score as well. The P represents the pupil reactivity score. So from the GCS, we subtract the pupil reactivity score, that gives the GCS-P score. So what happens in GCS-P score, the pupil reactivity score is actually the number of pupils which are unreactive. It is the number of pupils which are unreactive. Remember, the pupil reactivity score is the number of pupils which are unreactive, not reactive. So if both of the pupils are unreactive, it's a score of 2. If one pupil is unreactive, it's a score of 1. If neither of the pupil is unreactive, that means both of the pupils are normal, then it is a score of 2. So what is going to be the minimum and the maximum GCS-P score? Okay, so let's have a look at this one. The minimum GCS score is 1 plus 1 plus 1, 3, and the maximum is 4 plus 5 plus 6, that is 15. The minimum GCS-P score, 3 minus the maximum that we can subtract, is 2. Both the pupils unreactive, it is 2. So the minimum is 1. The maximum is 15 minus none of the pupil is unreactive, both are normal, it is 15. So remember, the GCS-P score minimum is 1 and maximum is 15. For GCS, it is 3 and 15. Because from the GCS, we are subtracting the pupil reactivity score. So it's actually like a negative score, right? So the higher the number, the more you are basically subtracting there. Okay. Now coming to our love story of the GCS, very, very interesting. So this is a love story where a girl and a boy, they fall into love and they decide to meet, right? So starting with the score of 2. So we will learn about a score of 2, 3, 4, 5, 6, right? 1 is none response. Okay, 1 is none. So we have E, we have V and we have M. Okay, it is E, V, M. Now what do we need to know here is 1 is basically none response, a none response and a none response. Remember, in the calculation of GCS, we look at the best response. Okay, we look at the best response, best eye response, best verbal response and the best motor response. Now starting with 2. Now number 2 is rhyming with shoe. So imagine that this girl is getting ready to go and meet her boyfriend and she decides to wear high heels ke sandals. Now to get those high heels, imagine like to her shoes, to her sandals, she has put an extension. Okay, the heel that she has, it is like an extension that has been put, and she walks with pressure. Okay, when she's going to meet her guy, she's walking with pressure. And that pressure is creating sound. Okay, she's walking with pressure so that, you know, the heel creates a lot of sound and she's noticed, right? So remember that, what does that mean? The heel is the extension. So the extension is the motor response. Extension is M2. Then she's walking with pressure. So eye opening to pressure or pain is E2. Then when she's walking with pressure, the heels are creating sound. So this is V2. Just sound is V2. It can also be called as the patient moaning. Moans, matlab it's just the sound. Okay, it is not words. So it is sound. So at the score of 2, basically you can see here 2 is shuka extension, walking with pressure, creating sound. That's an extension. Now at the score of 3, imagine like at the score of 3, the 3 is rhyming with a tree. So where are this guy and girl meeting? They are meeting under the tree. Okay, so they decide to meet under the tree, right? When they meet under the tree, they are having speech. They are talking to each other in a code language, which only they can understand and nobody else, even there's someone who's trying to peep in and hear what they are talking, they will not be able to understand. So basically they are having speech in inappropriate words, that is the code language. And in what position are they sitting under the tree? In abnormal flexion. Okay, they are cuddling up and they are sitting in abnormal flexion. So abnormal flexion is the M3. Abnormal flexion under the tree, that is 3M3. And they are talking in code language, that is inappropriate words. Okay, that is words here is V3. And what is the I response? They are having speech. Okay, they are talking. So if it is the I opening to speech, that is verbal command. Okay, you ask the patient to open the eye and the patient is able to open the eye, then it is verbal response, then it is E3. Okay, so that is for the score of 3. So under the tree, abnormal flexion, having speech in inappropriate words, that is what is 3. Now coming to 4. Now 4 is rhyming with more. So at the 4, their love grows more. Okay, so now at 4, their love grows more and they are noticed by the surrounding people, right? So when the surrounding people come there, they get confused and spontaneously they come back to normal position. That means they withdraw from the abnormal flexion that they were sitting in and they come back to normal flexion, right? So what is the E4 here? It is spontaneously. Okay, spontaneous eye opening, that is the maximum E score, E4, right? That was E4 maximum. And they become confused, okay, because they are spotted by the surrounding people, they get confused and they withdraw. So withdrawal from the abnormal flexion to the normal flexion. So normal flexion withdrawal, it is M4. Okay, so this is what is happening at the score of 4. So E4 spontaneously they withdraw from the abnormal flexion, come to normal flexion and they become confused. Okay, so confused and disoriented is basically V4. Now the maximum for E is 4, so there is no E5 and there is no E6. Now coming to V. Now at the score of 5, 5 is rhyming with wife. So now because they are spotted by everyone, their parents also get to know about their love story. So now the parents say, अभी या तो शादी कर लो या एक दूसरे को भूल जाओ, right? Either get married or forget each other. So of course they get married and now the girl becomes the wife. But now you know that after marriage, all the प्यार का भूत goes away. You know, it is the story that शादी के पहले तो तुम ऐसे नहीं थे, तुम अभी ऐसे हो गए, right? So now the wife becomes oriented. And like a typical wife, she keeps localizing her husband. Where are you? Where were you? With whom were you? Where were you? Right? So she keeps localizing her husband. So the wife becomes oriented and she keeps localizing the husband. So oriented speech, that is the maximum verbal score V5 and this is M5. So localizing is M5. Okay. So now you have the V, which is the maximum V verbal score is oriented, normal speech. There is no V6 now. Now you have only M6. So now at the score of 6, what is 6 rhyming with? 6 is rhyming with sticks. Okay, so what does the wife say? Obey my commands or I will beat you with the sticks. That is what she says to the husband. So it is obeying the command. That is what is M6. Okay, that is what is M6. So obey my commands or I will beat you with the sticks. So remember that this is the story of the GCS which completes from 1 is none 2 is basically rhyming with shoe, and under the tree, 3 is tree, 4 love grows more, 5 is the wife, and 6 is the sticks. Okay, so if you look at the table here, we are looking at the best response, best type, best verbal, and best motor response. If there's a question that which of these correlates well with the neurological outcome, it is the motor response which is the most important for the neurological outcome. Okay, so if you see here, at the score of 2, okay, there is eye opening to pain or pressure. Okay, the extension walking with pressure. So at the score of 2, it is pain and pressure, it is incomprehensible sounds, that is moaning, the shoe extension creates the sound, and it is extension. Okay, and it is extension. At the score of 3, 3 and 3. Okay, under the 3 opening to verbal commands, that means they have the speech and they are talking in inappropriate words, that is the code language, and there is flexion to pain. This is abnormal flexion. Okay, this is abnormal flexion. Withdrawal is normal flexion. At the score of 4, spontaneously they become confused and they withdraw from the abnormal flexion, they come back to normal flexion. At the score of 5, becomes the wife, localizes, becomes oriented. At the score of 6, sticks, obey my commands or I'll beat you with the sticks. Right. So try applying the story mnemonic. First try to do this recall. Close your eyes and just try to recall all the scores and then try to solve the MCQs based on this. I'm pretty sure that you'll be able to solve the MCQs on GCS score very fast, because remember that in exam, the speed is also very important, the accuracy is also very important. You cannot spend a lot of time on recollecting the GCS score and putting a lot of time there. Okay. Now, few more important points. Decerebrate. If in the question decerebrate is mentioned, what M score is that? Remember, it is M3, because remember that, it is M2, because remember that decerebrate is all E. All E basically means extension, and extension was the shoe ka extension. Shoe is rhyming with 2, so it is M2. Decorticate, if this is abnormal extension, decorticate is abnormal flexion, sitting under the tree in abnormal flexion, so it is M3. So decerebrate is M2 and decorticate is M3. Okay, decorticate is M3. Coming to the grades of head injury based on the GCS score. Now, since we can put this as mild, moderate, severe based on GCS. So, remember that mild, moderate, severe is like putting into an order. So, GCS is an example of the ordinal data scale. Okay, you can put in the order mild, moderate, severe. So, remember that from 9 to 12, basically this is moderate head injury. So, if the score is more than 12, it is better, it is mild head injury. If the score is less than 9, it is severe head injury. So, 9 to 12, remember the multiples of 3, 9, 12, 15, 15 is the maximum. 9 to 12 is moderate, more than 12 is mild, less than 9 is severe head injury or a state of coma. Okay, severe head injury or a state of coma. When do you give a score of non-testable? So, for example, when you are testing for verbal response, but the patient is intubated, the patient can actually speak, but because of the intubation, mechanical ventilation, the patient is not able to speak. So, you will not give a score of like non-response. The patient is able to speak, but because of the condition, circumstances, is not able to speak. So, you give NT. Okay, it is given non-testable and not a score of 1. Example, in an intubated patient or mechanical ventilation, the verbal response is given as VNT. In a person whose hands and feet are tied, cannot move the limbs, so the motor response cannot be tested. It is non-testable. Okay, it is non-testable. So, remember that when you have any component which is non-testable, you give the individual component score rather than giving the combined score, because that leads to false interpretation. So, you give the individual as a VNT, then you give E2, whatever is the score, VNT, M5. You don't give the combined score. Okay, you don't give the combined score in that case. That is non-testable, right? So now let's try to answer this question and see how fast you answer this question. A patient opens eyes in response to a loud voice. The patient moans and localizes the pain. What is the E score, what is the V score, and what is the M score? Now the patient is opening eye in response to loud voice. That means speech. Speech was under the tree, that is 3, so it is E3. Okay, that is loud voice is speech. Speech is under the tree, so 3. Moans. Moans is creating sounds. What creates sounds? The shoe extension. So remember, shoe is 2. So the verbal response is V2. Localizes the pain. Who localizes? The wife localizes at a score of 5. Wife is rhyming with 5. So remember, it is M5. So E3, V2, M5. So how much is the total score? 5 plus 5. So the total score becomes a score of 10. Okay, the total score is a score of 10. Right? So your homework is first try to recall the entire story and then solve the MCQs, and then do let me know how well did you perform with the GCS score MCQs. Thank you so much.